What we're doing today is to collect the main thing that we want to do. Two goals. One is to pass out literature about HR 676. So what I'll ask you to do is go to each house, and we'll divide up the streets. Knock on the door, and if they're not there, you can at least leave this little half sheet. Does this have our websites? Yeah, this has all the websites on the back. Thank you for doing that, Dick. You know, you can't put it in a mailbox, but you can put it in the door somehow. Roll it up between the doorknob and the frame. At least leave that. If they are home, what we're telling them is that we're out here making house calls for healthcare reform because house calls for healthcare reform because the majority of physicians and the public support a national health program based on single-payer financing. Congressman Sarbanes has not signed on to HR 676 despite several meetings with him, lots of requests, education, and so we're trying to show him that the people in his district do support national health program, and so we're asking people to sign on to this petition for HR 676, which we will then deliver to the congressman.
In Dumbarton School behind us.
Rogers Forge, nice neighborhood. Mm-hmm. A lot of people concerned about health care, and kind of the heart of Sarbanes district in a way, and we're trying to get out the message to people who have a good civic interest, as these people do, and they'll understand what single payer is and get a message to the congressman.
Now this is the 3rd congressional district.
That's correct.
Is that right? This is the old Eddie Garmatz district.
Kind of, except it's been withdrawn. It's kind of like a glove around Baltimore City. Goes down into Anne Arundel County too. But this is very much Sarbanes territory.
Well, I think it's important to get the information out about single-payer health care and how it's the only long-term viable option for adequate health care for Americans.
And so we're out here today in, I think, just a little slice of Baltimore County right here.
Right. I live in the city, not too far away, but this one-size-fits-all idea about single-payer is very good. It's great for everybody.
You feel like you're building up a consciousness about this issue with the people at the grassroots level?
I think we are. I think people are aware, perhaps subliminally, about their health, the health situation and their problems about being able to pay for their health care. And this is just a way of crystallizing and catalyzing the ideas that probably are fermenting just under the surface. And I think it's a very important effort that we're doing here.
I wanted to see a national health program that includes everybody, so that people are safe when it comes to health care and not going into bankruptcy.
So you think the current situation, the current healthcare situation would be, could you call it a crisis?
Oh yeah, it's definitely a crisis. We're losing lives every day because of lack of access.
I think I see numbers like I heard Ralph Nader say 22,000 people a year
last
dying.
Estimates were 22,000 a year. That was in 06, are dying because of lack of access.
And that was 7 times the number that died at the World Trade Center.
World Trade Center, yeah.
And
you can see it in the outcome numbers when you compare the United States to other countries where our medical care system ranks 37th in outcome, which is, I think we're right behind Morocco.
And that's a nice way to say we're really behind the curve.
Yeah, we really are behind the curve.
Yeah.
So this is a perfect community to begin to explore the idea that the Maryland Coalition for Health Security is doing, and the Maryland branch of PNHP, Physicians for National Health Program, which is the idea of doctors making house calls for healthcare reform. Rogers Forge has 1,777 homes in it, and this is a community where you're beginning to see that people are suffering financially, and as we know, bankruptcy is related to health care bills that can't be paid because health insurance companies in this state are making profits while we're having a harder time paying bills. As you walk through Rogers Forge, what you might notice is that there are many, many, many homes for sale and an increasing number of homes for rent, and larger than I've ever seen in all these years, and it's a sign that people are suffering. One of the reasons why we're having such trouble paying our bills, and one of the reasons why employers are having such difficulty, is that we have employer-based health care. and its health insurance companies and their business allies and their paid-off members of Congress who control this. It's time for change, and this is the beginning of asking my representative, John Sarbanes, to sign on to H.R. 676 and become a champion for single-payer health care. Representative Donna Edwards is a newbie just like he is, and yet she's showing leadership. And people in Representative Sarbanes' district are looking for this kind of leadership for him.
I feel very strongly that health care should be a right, not a privilege for people who are wealthy or elite or government employees. I think everybody should have access to health care. I don't think it should be a mandate, something that's required and you're punished if you don't have it with tax sanctions or other kinds of punishments. I think it should be a right, and every resident of this country should have access to health care. And I say resident specifically because if we limit it to citizens, we've got millions of undocumented workers here, and guess what? They cough, they give you TB, they need access to health care too. It's a human right. And it's long past due that this country recognizes that in the same way that every other industrialized country recognizes that. And it's going to save money, and it's going to help our businesses, and it's going to help our citizens, and I can go on and on about how passionate I feel about the every resident.
One of the things we're really trying to push for right now is an amendment that would make it easier for states to do a single-payer system.
And put that in the new bill that's passed.
Yeah. Sanders has an amendment that was supposed to be introduced on Thursday. They were doing the markups, and the Republicans had put in so many amendments that it was just really like tying things up.
Is that 703?
His bill is at 703, but the amendment, it's just an amendment. I don't know that it has a. I'm trying to think. I have a copy of it on my computer, but so that's a big thing that we're lobbying on in the House right now, is at least allow the states to do it, because that's going to come up for a vote in the Education and Labor Committee on the House side. I'm with a group called Physicians for National Health Program, and we support a national health program based on single-payer financing. Have you ever heard of? Yeah. Have you? Great. We're urging Congressman Sarbanes to sign on to the bill, which is H.R. 676, because we've been meeting with him. He's still reluctant to sign on and wants to see whether his community supports this or not.
Why does he oppose it? I'm not sure.
Great question, because the first time we met with him and we presented it to him, he was really interested in it because he started the Public Justice Center, and he's very much into justice, and this is the only thing that creates a health system that includes everybody and allows everybody to get care. And
I always thought it was a core Democratic Party stance.
Yeah, I mean, what we're running into a lot, because I spend a lot of time down in Congress, is that a lot of it comes down to campaign financing and who does that. So
Healthcare companies give a huge amount.
So the only thing that overcomes that is, showing that the voters support it, and that's why we're out here. Because the only way we're really going to push him is to show him that this is what people want. So, would you be interested in signing the petition? Oh, that's awesome. I don't care.
I'll try to touch as little of it as possible.
Don't worry about it. We don't care. So how did you learn about this issue?
I'm sort of a political junkie, I guess.
Okay, great.
That's great.